This was an interesting study that looked at, they did endoscopic swallow studies, and they looked at swallowing for 4 different liquids that on the surface don't seem to be very different. Whole milk, 2% milk, skim milk, water. All 4 of those liquids would be considered to be thin liquids, right? They would fall into that thin liquid range. But they found that there were in fact differences in swallow function when they compared whole milk and 2% milk to skim milk and water. I think the message here for us is that it doesn't have to be an all or nothing kind of recommendation. There may be something on the thicker end of the thin liquid range, if you will, that our patient might be safe with, that our patient might be able to tolerate. So rather than restricting all thin liquids, maybe we can explore that a little bit and see, are there some liquids that would be considered in the thin range that would be acceptable? Now, I know that this is sometimes tricky in terms of getting orders and communicating with the kitchen. So, what you might consider is maybe something like nectar liquids, but patient may have A, B, and C. So sort of identifying 2 or 3 liquids in the thin range that the patient was able to have.